Hello, I am Sylvia Azania, and in this video, we are going to talk about the pre-testicular, testicular, and post-testicular causes of oligospermia. We will also discuss whether oligospermia is permanent or reversible, and answer the most frequently asked questions that users have in relation to this specific topic. A decrease in the overall concentration of spermatozoa in the ejaculate can be caused by various pre-testicular factors. These types of causes of oligozoospermia are those that are generally considered to be indirectly related to sperm formation, such as the following cases: alteration of hormones secreted by the pituitary gland, prolactin, FSH, and LH, administration of anabolic hormones, poor diet, unhealthy habits, tobacco, drugs, and alcohol, exposure to environmental toxins or radiation, and stress. All these situations disrupt the normal operation of the body and influence the sperm production, among other issues. Nevertheless, regaining a normal sperm count might be achievable by committing to a more wholesome way of living. In the specific case of athletes taking anabolic hormones, testicular function recovers once this treatment ceases. The origin of testicular oligospermia is due to alterations in the testicles that affect the process of spermatogenesis. For this reason, it is a secretory type of oligospermia, since there are no problems with ejaculating the semen, but rather with the production of the spermatozoa. Among the most frequent testicular causes we can mention cryptorchidism. Testicles do not descend into the scrotum and their temperature is not adequate. Hydrocele. Excessive accumulation of fluid within the spermatic cord structure. Varicocele, a dilation of the veins in the spermatic cord. Orchitis, inflammation of the testicle due to infection. Blows or trauma that directly affect the genitals. And genetic alterations such as microdeletions of the Y chromosome. Surgery can resolve some of these conditions, which can re-establish some or all of the lost fertility. Is the case of cryptorchidism, varicocele, or hydrocele. A sign that we encounter in oligospermia resulting from testicular causes is a high level of FSH. This is because FSH is the hormone responsible for stimulating the testicle in order to produce the sperm. Because this stimulation isn't working, the FSH level increases in an attempt to make the testicle react to the signal. And before we move on to the content of this video, I would really appreciate it if you could give it a like and subscribe to the channel if you haven't done so yet, because it helps us tremendously so that all the information we publish can reach a wider audience. Even if the sperm cells are synthesized in a proper manner in the testicle, it is entirely possible that there may be an obstruction preventing their full ejaculation, which would cause an obstructive oligozoospermia due to post-testicular causes. The obstruction can take place within the vas deferens, the epididymis, or the urethra, and can be caused by cases such as the following: complications from a testicular surgical procedure that cause some kind of cut, genetic abnormalities that impact how the male reproductive tract develops, illnesses such as the mumps or meningitis that occur before puberty, and inflammations, cysts, and traumas. This particular type of oligozoospermia is the mildest because sperm is indeed being produced. The only requirement is finding a suitable method to retrieve them. For this, a repair surgery can be performed, or they can be obtained through testicular biopsy in order to use them in vitro fertilization treatment. Oligospermia is usually permanent when the origin of its appearance is due to genetic problems such as mutations on the chromosome, atrophy in the seminiferous tubules, location where sperm cells are produced, or related chronic illnesses. However, oligospermia is reversible when the cause of having few spermatozoa is a hormonal imbalance, possibly due to stress, a fever episode, or unhealthy lifestyle habits, for example. In such instances, the normal sperm count can be restored by adhering to the correct treatment regimen over several months. And now we are going to answer some of the most frequently asked questions users have concerning this subject. Is oligospermia due to genetic causes possible? Yes, it is entirely possible that the cause of oligospermia, meaning that the concentration of sperm cells in the ejaculate is low, is genetic, specifically due to factors such as microdeletions on the Y chromosome. If you wish to learn more about these microdeletions, you can check out the article linked in the tags. Can drinking too much coffee cause oligospermia? Consuming excessive amounts of caffeine might indeed be linked to a reduction in sperm concentration. However, it might just be one additional element within a combination of poor habits, such as neglecting nutrition or overusing tobacco, alcohol, or other substances. We would really love to hear about your experience, so I encourage you to leave us a comment, and I remind you that in the description, you have the link to an article where you can read much more information related to this topic.